My name is Megan. I've been doing EEGs for about 17 years. I am registered and I got my certification through ABRAT. This is our routine EEG machine. This is the amplifier, which contains 27 electrodes that are then applied individually to the patient's scalp for the EEG. Attached is also the photic stimulation light, which is an activation procedure that we do during the test. So the photic lamp is basically a strobe light that is flashed during the EEG. It flashes at different speeds and frequencies to help bring out any abnormality, if any, with the patient. We also do another activation procedure during the test, which is called hyperventilation, and that is just breathing in and out of your mouth more rapidly than you're breathing now for about 3 minutes, just like you're blowing birthday candles out. And that's also to help bring out any abnormality, if any. So attached to the machine as well, we also have a camera that's for the doctor's purposes on review to see if the patient had anything clinically as far as like a seizure or any muscle twitching, facial movements, anything like that. So I'll bring the patient in and have them lie down on the stretcher. And then I will explain to them that I'm going to take some measurements of their head. I'm going to be marking with a China marker so that I know where all the electrodes are going. And then I will clean those areas off with 2 Q-tips and a gritty soap. And then I will paste the electrodes onto their scalp. Okay, Keely, what I'm going to do first is just take some quick measurements of your head, and I'm just going to be marking so that I know where all the electrodes have to go.
Okay.
What I'm going to do now is just clean off those areas a little bit with a little gritty soap, okay?
Okay.
Okay, now we're going to turn her head. I'm going to start placing all those electrodes on. So we take measurements of the patient's scalp to know exactly where each electrodes go. And then on the amplifier, there is a picture of the head, and they are labeled like frontal, central, temporal, and occipital, so we know exactly that's where they need to be. Okay, all the electrodes are on, so we're going to start the last part of the test. What I need you to do is just relax and keep your eyes closed, and just keep nice and still. I'll ask you to open and close your eyes a couple times right at the beginning, but I only need you to do that when I ask you to.
Okay.
I'll also be flashing a strobe light in the room. That's going to flash on and off every 10 seconds at different speeds. All you need to do is keep your eyes closed. After the strobe light is finished, we're going to do that breathing exercise, which is breathing in and out of your mouth more rapidly than you're breathing now for 3 minutes. And it's just like you're blowing birthday candles out, okay?
Okay.
And then just continue to relax after that. Test is going to be about 20 minutes, and I'll get everything cleaned out of your hair once we're done. Okay, Keely, just continue to keep your eyes closed. I'm going to start flashing that strobe light. What I'm looking for when the strobe light is flashing is to see if we can bring out any abnormality clearer for the doctor that's reading the EEG. A lot of times we see some increase in muscle tension. Patients do sometimes find that the strobe light is a little annoying to them. Okay, Keely, just continue to keep your eyes closed for me. When I tell you to start, I want you to take that deep breath in, forceful exhale out, just like you're blowing candles out. Okay, go ahead and start now. In and out of your mouth. Keep going, just like that. Don't stop. You can do it for 3 minutes. If you feel a little dizzied or lightheaded, that's completely normal. Just keep going. Okay, you can stop. Breathe normal now. Just continue to relax for the rest of the test. I'll let you know when we're all finished. Okay, Keely, you can go ahead and open your eyes. We're all finished. I'm just going to get everything cleaned out of your hair, okay?